Hello ladies and gentlemen. This is Remedy 24 channel. Today we'll go over the 8 signs and symptoms of vitamin D deficiency. Vitamin D is a vital nutrient that has a wide range of effects on your body's many systems. Vitamin D, unlike other vitamins, acts as a hormone. It has a receptor on every single cell in your body. When your skin is exposed to sunshine, your body produces it from cholesterol. It's also found in specific foods like fatty fish and fortified dairy products, though getting enough from diet alone is difficult. The recommended dietary allowance for vitamin D is roughly 600 to 800 U for most adults. However, many experts recommend obtaining considerably more. Vitamin D insufficiency is a typical occurrence. Around 1 billion people globally are thought to have inadequate vitamin D levels in their blood. According to one study, 41.6% of adult Americans are vitamin D deficient. In Hispanic adults, this percentage rises to 69.2%, and in African American adults, it rises to 82.1%. Here are some of the most frequent vitamin D insufficiency risk factors. 1. Having dark skin. 2. Being an older adult. 3. Being overweight or having obesity. 4. Not eating much fish or dairy. 5. Living far from the equator in areas where there is little sun year-round. 6. Always using sunscreen when going out. However, using sunscreen is important in helping prevent sun-damaging effects to the skin, including skin cancer. 7. Staying indoors. 8. Having chronic kidney disease, liver disease, or hyperparathyroidism. 9. Having a health condition that affects nutrient absorption, such as Crohn's disease or celiac disease. 10. Having gastric bypass surgery. 11. Using certain medications that impact vitamin D metabolism. People who live near the equator and get plenty of light are less likely to be deficient in vitamin D because their skin produces enough to meet their body's needs. The majority of people are unaware that they are deficient because the symptoms are usually modest. Even if they have a big impact on your quality of life, you might not notice them right away. Number 1. Getting ill or infected frequently. One of vitamin D's most critical functions is to maintain your immune system robust so you can fight off illness-causing viruses and bacteria. It interacts directly with the cells that are in charge of battling an infection. Low vitamin D levels may be a contributing cause if you become sick frequently, especially with colds or the flu. A relationship between a deficit and respiratory tract illnesses such as colds, bronchitis, and pneumonia have been discovered in several large observational studies. Taking vitamin D supplements at a dose of up to 4,000 U per day has been shown in several studies to lessen the incidence of respiratory tract infections. Only those who were significantly deficient in vitamin D saw substantial advantage after taking a high-dose supplement for a year in an older trial including adults with chronic obstructive lung disease. Number 2. Fatigue and exhaustion. Tiredness can be caused by a variety of factors, including vitamin D insufficiency. Regrettably, it's frequently neglected as a possible explanation. According to case studies, very low vitamin D levels in the blood can produce weariness, which can have a significant negative impact on quality of life. A woman with recurrent daytime weariness and headaches was found to have a vitamin D blood level of only 5.9 Ng per milliliters in an older case study. Anything below 20 Ng per milliliters is considered inadequate, thus this is incredibly low. The woman's vitamin D level increased to 39 Ng per milliliters after she took a vitamin D pill, and her symptoms went away. Low vitamin D levels and self-reported weariness were also linked in one observational research of female nurses. Moreover, the study discovered that 89% of the nurses were incompetent. Interestingly, some studies have discovered that supplementing with vitamin D might help patients with a shortage feel less tired. Number 3. Back and bone pain. Vitamin D helps maintain bone health in several ways. For one, it improves your body's absorption of calcium. Bone pain and lower back pain may be signs of inadequate vitamin D levels in the blood. Large observational studies have found a relationship between a deficiency and chronic lower back pain. One study in 98 people with lower back pain found that increased pain severity was associated with lower levels of vitamin D. Another review of 81 studies also found that people with arthritis, muscle pain, and chronic widespread pain tended to have lower levels of vitamin D compared with people without these conditions. Number 4. Depression. A depressed mood may also be a sign of vitamin D deficiency. In review studies, researchers have linked vitamin D deficiency to depression, particularly in older adults. In one analysis, 65% of the observational studies found a relationship between low blood levels and depression. On the other hand, most of the controlled trials, which carry more scientific weight than observational studies, did not show a link between the two. However, the researchers who analyzed the studies noted that the dosages of vitamin D in controlled studies were often very low. In addition, they observed that some of the studies may not have lasted long enough to see the effect of taking supplements on mood. Some studies have shown that giving vitamin D to deficient people helps improve depression, including seasonal depression, which typically occurs during the colder months. Number 5. Impaired wound healing. Slow healing of wounds after surgery or injury may be a sign that your vitamin D levels are too low. In fact, results from a test tube study suggest that the vitamin increases the production of compounds that are crucial for forming new skin as part of the wound healing process. One review of 4 studies found that vitamin D deficiency compromised certain aspects of healing in people who had dental surgery. It's also been suggested that vitamin D's role in controlling inflammation and fighting infection is important for proper healing. One analysis looked at patients with diabetic foot infections. It found that those with severe vitamin D deficiency were more likely to have higher levels of inflammatory markers that can jeopardize healing. Unfortunately, there is very little research about the effects of vitamin D supplements on wound healing in people with a deficiency at this point. However, one study involving 60 people with diabetic foot ulcers found that taking a vitamin D supplement for 12 weeks significantly improved wound healing compared with the control group. Number 6. Bone loss. Vitamin D plays a crucial role in calcium absorption and bone metabolism. Many older people who are diagnosed with bone loss believe they need to take more calcium. However, they may be deficient in vitamin D as well. Low bone mineral density is an indication that your bones have lost calcium and other minerals. This places older adults, especially women, at an increased risk for fractures. In a large observational study in more than 1,100 middle-aged menopausal or postmenopausal women, researchers found a strong link between low vitamin D levels and low bone mineral density. However, a controlled study found that women who were deficient in vitamin D experienced no improvement in bone mineral density when they took high-dose supplements, even if their blood levels improved. Regardless of these findings, adequate vitamin D intake and maintaining blood levels within the optimal range may be a good strategy for protecting bone mass and reducing fracture risk. Number 7. Hair loss. Hair loss is often attributed to stress, which is certainly a common cause. However, when hair loss is severe, it may be the result of a disease or nutrient deficiency. Hair loss in women has been linked to low vitamin D levels, though there is very little research on this to date. In particular, research suggests that low vitamin D levels are linked to alopecia areata and may be a risk factor for developing the disease. Alopecia areata is an autoimmune disease characterized by severe hair loss from the head and other parts of the body. It's associated with rickets, which is a disease that causes soft bones in children due to vitamin D deficiency. One study in people with alopecia areata showed that lower vitamin D blood levels tended to be associated with more severe hair loss. In another study, applying a synthetic form of the vitamin topically for 12 weeks was found to significantly increase hair regrowth in 48 people with alopecia areata. Many other foods and nutrients may affect the health of your hair. If you experience hair loss, you may be interested in the 14 best foods for hair growth. Number 8. Muscle pain. The causes of muscle pain are often difficult to pinpoint. There's some evidence that vitamin D deficiency may be a potential cause of muscle pain in children and adults. In one study, 71% of people with chronic pain were found to be deficient. The vitamin D receptor is present in nerve cells called nociceptors, which sense pain. According to one review, vitamin D may be involved in the body's pain signaling pathways, which could play a role in chronic pain. A few studies have found that taking high-dose vitamin D supplements may reduce various types of pain in deficient people. One study in 120 children with vitamin D deficiency who had growing pains found that a single dose of the vitamin reduced pain scores by an average of 57%. Vitamin D deficiency is incredibly common, and most people are unaware of it. That's because the symptoms are often subtle and nonspecific, meaning that it's hard to know if they are caused by low vitamin D levels or other factors. If you think you may have a deficiency, you must speak with your doctor and get your blood levels measured. Fortunately, a vitamin D deficiency is usually easy to fix.